Hello, and welcome. Today we are going to talk about a very important topic that affects millions of people around the world: heart failure and the early warning signs that many people ignore until it becomes dangerous. The heart is one of the most powerful and essential organs in the human body. It works continuously, every second of your life, pumping blood through a network of vessels that deliver oxygen and nutrients to every organ and tissue. When the heart functions properly, most people never think about it. But when the heart begins to weaken, the effects can impact the entire body. Heart failure does not mean the heart suddenly stops. Instead, it means the heart muscle becomes weaker or less efficient at pumping blood. This condition often develops slowly over many months or even years, and because the progression is gradual, people frequently miss the early symptoms. They assume they are simply getting older, tired, or out of shape. But the body is often sending signals long before a serious medical emergency occurs. Understanding these signals can literally save your life. Heart failure can develop for many different reasons. One of the most common causes is high blood pressure. When blood pressure remains elevated for years, the heart must work harder to pump blood against resistance. Over time, this extra workload causes the heart muscle to thicken and eventually weaken. Another major cause is coronary artery disease, which occurs when blood vessels supplying the heart become narrowed or blocked. Heart attacks can damage heart tissue permanently, reducing its ability to pump effectively. Conditions such as diabetes, obesity, kidney disease, and valve disorders also increase the risk of developing heart failure. Lifestyle factors play a significant role as well. Smoking damages blood vessels and reduces oxygen delivery. Excessive alcohol intake can weaken the heart muscle. Lack of physical activity reduces cardiovascular fitness. Over time, these factors create strain on the heart. When the heart becomes weaker, circulation becomes less efficient. Blood may move more slowly through the body, and fluid can begin to accumulate in tissues and organs. This is when symptoms start to appear. In the early stages, symptoms may be mild and easy to ignore, but recognizing them early can make a huge difference in treatment outcomes and quality of life. In this video, we will discuss the most important warning signs you should never ignore. Why they happen. One of the earliest and most common warning signs of heart failure is unusual fatigue. This type of fatigue feels different from normal tiredness that people experience after a long day or poor sleep. Instead, it is a persistent lack of energy that does not improve with rest. You may notice that activities which were previously easy suddenly become difficult. Walking short distances, climbing stairs, carrying groceries, or performing routine daily tasks may leave you feeling exhausted. This happens because the muscles and tissues in your body are not receiving enough oxygen-rich blood. When the heart cannot pump effectively, the body prioritizes blood flow to essential organs such as the brain and heart itself. As a result, the muscles receive less circulation, leading to weakness and fatigue. Many individuals dismiss this symptom as a normal part of aging or stress. However, persistent fatigue that develops gradually over time should not be ignored. It may be one of the first indicators that the heart is struggling. Another factor contributing to fatigue is poor circulation to the brain. Reduced oxygen delivery can lead to difficulty concentrating, mental fog, and decreased alertness. Some people describe this as feeling drained or lacking motivation. In reality, the body is working harder to compensate for reduced heart function. If fatigue continues for weeks or months without improvement, medical evaluation is important. Early diagnosis allows for better management and improved quality of life. Shortness of breath is another major symptom associated with heart failure. At first, it may only occur during physical activity. You may notice that you become winded more easily than before when walking, climbing stairs, or exercising. As the condition progresses, breathing difficulties may occur even during rest. Some individuals experience discomfort when lying flat and need extra pillows to sleep comfortably. Others may wake up suddenly at night, feeling like they cannot breathe. This symptom is known as paroxysmal nocturnal dyspnea. The underlying cause is fluid accumulation in the lungs. When the heart cannot pump efficiently, blood backs up into the pulmonary circulation. Fluid leaks into lung tissue, making oxygen exchange more difficult. This results in a sensation of breathlessness. Shortness of breath can also lead to anxiety and fear, which further worsens breathing. Because breathing problems are common in many conditions, People sometimes ignore them or attribute them to aging or lack of fitness. However, persistent or worsening shortness of breath should always be evaluated by a healthcare professional. Swelling in the legs, ankles, or feet is another common sign of heart failure. This swelling occurs because fluid accumulates in body tissues when circulation slows down. You may notice that shoes feel tighter or socks leave marks on your skin. Swelling often becomes worse later in the day, especially after standing or sitting for long periods. In more advanced cases, swelling may also occur in the abdomen. This condition is known as edema. Fluid retention may also cause rapid weight gain over a short period of time. For example, gaining several pounds within a few days can indicate fluid buildup rather than fat accumulation. The reason fluid accumulates is because the kidneys receive less blood flow when the heart is weak. This triggers hormonal changes that cause the body to retain salt and water. While this response is meant to help maintain circulation, it often worsens fluid retention. Monitoring swelling and weight changes can help detect worsening heart function early. If swelling increases suddenly or becomes severe, medical attention is necessary. Another important symptom is a rapid or irregular heartbeat. When the heart becomes weaker, it attempts to compensate by beating faster in order to maintain circulation. This may create sensations known as palpitations. People often describe palpitations as fluttering, pounding, or skipping beats. Irregular heart rhythms are common in individuals with heart failure. One example is atrial fibrillation, which can further reduce heart efficiency. In addition to palpitations, some people may experience dizziness or lightheadedness. Reduced blood flow to the brain can cause faintness or even fainting in severe cases. Cold hands and feet may also occur because circulation is redirected toward vital organs. Other symptoms may include persistent coughing, loss of appetite, nausea, or confusion. These signs indicate that the body is not receiving adequate circulation. The good news is that many lifestyle changes can help reduce risk and improve heart function. Maintaining healthy blood pressure, exercising regularly, eating a balanced diet, limiting salt intake, avoiding smoking, and managing stress are all important. Modern medical treatments can significantly improve outcomes. Early recognition remains the most powerful tool. Always listen to your body. Your heart works continuously for you every moment of your life. Taking care of it is one of the most important decisions you can make.